Welcome back. Did you know that more women today are surviving gynecologic cancer than ever before? But with 100,000 women being diagnosed every year, it's important to understand the risks. That's why we have Dr. Diago Torres, a gynecologic oncologist at Ochsner Baptist, joining us this morning to talk about what women need to know. Welcome, doctor, to the show.
Thank you for having me, Malik.
Thank you so much for talking to us about this type of cancer this morning because it was really alarming when I read it at the top. 100,000 women will get it every year. That's one case every 7 minutes. For people who do not know about gynecologic cancer or GYN, how do people get it and what are some of the common symptoms?
Sure. Gynecologic cancers are cancers that begin in the reproductive tract. And they include cancers that begin in the ovary, the uterus, the cervix, the vagina, and the vulva. The vulva is considered the outside of the vagina. And the three most common gynecologic cancers are ovarian, uterine, which we often refer to as endometrial, and cervical cancers. And the symptoms vary by type of gynecologic cancer, but in general, they tend to be one of the following. And as y'all can see, they're listed as bullet points. Unfortunately, these symptoms can be very, very vague, but most commonly, the symptoms associated with endometrial, ovarian, and cervical cancer include abnormal bleeding. And really, we define abnormal bleeding as any vaginal bleeding that's in between periods, heavier than usual, or any vaginal bleeding after menopause.
And what's really interesting is that changes in bathroom habits. What do you mean by that? We're going to the bathroom more or less?
Exactly. So, everyone sort of has their own routine. If there's a change in that routine, so if you're going more often, if you notice blood or mucus in your stool or urine, those are red flags. And what I tell my patients is that if you're experiencing changes in your bowel or bladder habits more often than not, so if more days of the week you're having diarrhea than you're used to, that's a red flag, and you should see your doctor about it.
And what should women know about how to reduce their risk of getting one of these different types of GYN?
Yeah, so it really depends on the type of gynecologic cancer. But in general, I think there are four important things that women can do to reduce their risk of developing a gynecologic cancer. I think first and foremost, listen to your body. Like we talked about, there are symptoms associated with gynecologic cancers. They are vague, but if you're having those symptoms more often than not, you need to speak to your doctor. And you should definitely see an OBGYN or a primary care doctor once a year, because those visits include pelvic exams and screening for pap smears. And we begin pap smears at age 21 and usually repeat them every 3 to 5 years until age 65. So that annual visit is extremely important.
And when it comes to this HPV vaccine, when should women get this vaccine, and when do you get it once and then you're good, or you have to get that every year as well?
That's a great question, and it's a point that I really want to emphasize, and that is that all women should receive the HPV vaccine. They can receive, there's different types of HPV vaccines, but you can begin receiving the vaccine as early as 9 years old. And depending on which type of vaccine you receive, there's different numbers of vaccines you need to receive before you develop protection against the HPV virus, because it's the HPV virus that causes cervix cancer. So it's truly one of the unique cancers because it's caused by a virus, and it's one of the cancers that we can completely prevent with the HPV vaccine, and also routine annual visits. So to answer your question, all women should receive it. They can receive it as early as 9 years of age, up to age 45 years old. And there's usually a couple of doses that you need to receive before you're protected against the HPV vaccine.
Very important to know. Great conversation this morning, Doctor. And before we go, I want to congratulate you all on the new Gail and Tom Vincent Cancer Center at Ochsner Medical Center. It is gorgeous. Congratulations on that. And hey, there's some ways that you can help support that beautiful new cancer facility. You can enlist in their text to give program. All you have to do is text the word Ochsner to 243-725, or you can purchase raffle tickets to their Moonlight and Miracles Gala happening Sunday, November 1st. You can buy a $100 raffle ticket and you'll be entered to win a Mercedes Benz GLB. And they're only selling 1,000 tickets. So for more information on tickets, visit ochsner.org/moonlight. And for more about your risk of gynecologic cancer and how to treat it, if you have it, you can log on to ochsner.org/services/gynecologic-oncology.